Hi there, nice to meet you.
Nice to meet you.
Hi there.
A carefully choreographed visit to a southeast London GP surgery by England's Health Secretary this morning.
I think we've worked harder, definitely.
Yet he had already managed to upset family doctors with plans to name and shame those who don't offer more face-to-face appointments. The announcement did come with a £250,000 winter access fund to help pay for locums and to offer those in-person consultations if, as the press release said, that's what the patient wants.
Today's package is all about support, about providing GPs with ever more support so they can do more of what they love doing, which is seeing their patients. It's about having more appointments and having more prompt appointments and allowing patients to have more choice in the way that they're seen.
Even at the surgery, though, they were not impressed.
We don't have the bodies. It's not about the funding or injecting the millions into the service. If the GPs aren't available, we can't provide the appointments that they need. And the problem that's happening now is individual GPs are having extra patients on top of their fully booked sessions, and this is creating a lot of pressure mentally on GPs, but also it's unsafe.
Figures released this week showed 58% of GP appointments in England in August were face-to-face, compared with 80% before the pandemic. Doctors argue that a valuable lesson learned from this crisis was that a mix of telephone and face-to-face consultations do work. And Mr. Javed has noticeably not put a target on this. Have you written or spoken to Mr. Javed today about his blueprint?
Well, we have open communication with the Secretary of State and his office. He's aware that we are not happy about the offer. We don't think it's a legitimate or useful offer. We don't think it's an offer that's going to solve the very significant problems that we have. And I hope that he will take that on board, and I hope that he'll do something about it.
Separate guidance issued today also suggests surgeries could drop the 2-metre rule in waiting rooms, putting them more in line with hospitals and allowing them to fit in more patients. It's not just GPs that are under pressure, it's the entire NHS. Not enough staff, too many patients, and of course there is still COVID. This trust, Guy's and St Thomas's, there were reports of not enough critical care staff, and that in turn can affect elective surgery. One insider has told me that nurses in particular are leaving because they are burnt out from the pandemic. And today's figures for August, that's in the summer, provided by NHS England, are stark. 5.7 million were waiting for hospital treatment, the highest number since records began in 2007. And those waiting more than 2 years had risen to a new record of nearly 10,000. And as for A&Es, a quarter of A&E arrivals had to wait more than 4 hours to be admitted, transferred or discharged, and more than 5,000 had to wait 12 hours, so-called trolley waits, an 80% increase on the previous month. Similar pressures are being seen across the UK. A&E waiting times in Scotland and Wales are also the worst on record. And today, health service bosses in England admitted the NHS was running hot, although the message remained that patients should seek treatment if they felt unwell.
Victoria MacDonald. Now, earlier I spoke to the London GP, Dr. Claire Gerada, who is due to become the new president of the Royal College of GPs next month. I started by asking her why patients shouldn't be able to have a face-to-face consultation with their doctor.
They should have a face-to-face appointment with a doctor if they need one. And this debate, and I'm really curious why, has become so polarised between face-to-face or non-face-to-face. Probably we can deal with about 60 to 70% of the needs of patients done remotely. So they don't actually need to see us face to face. But if they do need to see us, or indeed if they want to see us, then of course they can.
But it's a terrible outcome from COVID if in fact the real consequence is going to be a very, very considerable reduction of face-to-face access to your local GP.
John, it's a very positive outcome. We're actually in the midst of a digital health revolution, a revolution that probably started 15 years ago. And what the pandemic has done is catalyze that, it's exploded that, rather like the banking revolution, the shopping revolution. What we're actually trying to do, John, is to try and make sure that those who need to see us face to face have longer time with us, we're more accessible for them, we can deal with their problems in a much more in-depth way, and those that don't need to, and many don't want to come in face to face even before the pandemic.
I do get the digital aspect, and clearly that's a plus, but the minus is bound to be, and I'd almost take a bet with you that within a year of this, the expansion of people trying to access accident emergency in order to see a doctor will be great.
John, it's already happening, but again, pre-pandemic, I know that doesn't seem a long time ago, GPs were blamed for the queues in accident and emergency. And when it was actually looked at properly, the queues for accident and emergency were actually because we couldn't move patients from the A&E department into a hospital bed. So that was what the major delay was. Now, there are patients, and hands up at the end of 60, 80 patients a day, I'm exhausted and I can't do any more, that there are some patients sitting in A&E now who should be seeing their GP but can't because we're overwhelmed with demand. But I would predict in 2 years' time, this debate won't be about digital or face-to-face. It will be about how do we streamline the whole service so patients can start their health journey, if you like, in their sitting room at home, maybe supported by their daughter or son, start that journey, ending up in the right place at the right time with the right clinician.
After COVID, how difficult is it for GPs today? I mean, are you demoralised?
Listen, I love my job. I've done it for 35 years. I adore it. But at the end of a day's work, me, robust 62-year-old, been doing this for decades, I come home and feel like crying. My profession is probably at the end of their tether. We're nice people, really, GPs are. We go into it because we love patients.
Dr. Claire Gerardo, thank you very much indeed for talking with us.
Thank you.